Hello, and welcome everyone to PACE Celebrates and the inaugural presentation of our Changemakers in Healthcare Awards. I'm Marvin Krislov, the president of PACE University, and I'm very pleased we have so many alumni, supporters, and friends of PACE to help us celebrate this evening. Thanks to all of you, and thanks especially to our three honorees, Dr. Steve Corwin of New York Presbyterian, Mike DiSimone of PayFlex, and our very own Dean, Harriet Feldman, for being here tonight. I'd also like to thank our title sponsors, New York Presbyterian and RSC Solutions, and our supporting sponsors as well, Broadridge Financial Solutions, PayFlex, and the Seidenberg Family Foundation. We greatly appreciate their generosity. PACE Celebrates is a way for us to honor extraordinary leaders who exemplify the PACE ethos of success in their professional lives and their commitment to giving back by being at the forefront of creating opportunities for everyone in our communities. The proceeds from PACE Celebrates directly support impact scholarships for deserving students, helping to ensure that we're educating the next generation of leaders. This year, as we celebrate our very first Changemakers in Healthcare, you are providing scholarship support for students in our College of Health Professions. PACE has a long and proud tradition of educating health professionals, and we're here tonight to present our Changemakers in Healthcare Award, our very first award of this award to three very deserving leaders. I'm going to introduce each Changemaker awardee, and then they'll make some brief remarks. After that, we'll have a panel discussion about the current and future state of healthcare and healthcare education. And we know that there's probably no more important topic today, and we're so glad to have these changemakers with us. So without further ado, please allow me to introduce the 2021 PACE Changemaker Award honorees. Dr. Stephen Corwin is President and Chief Executive Officer of New York Presbyterian, one of the nation's most comprehensive healthcare systems. Under his leadership, New York Pres has nearly doubled in size. Today, it has more than 47,000 employees and affiliated physicians providing world-class care at 10 hospitals and 200 primary and specialty clinics and practices throughout the region. And New York Presbyterian Hospital, the only academic medical center in the country affiliated with two medical schools, both Columbia University's Vangelis College of Physicians and Surgeons and Weill Cornell Medicine, is ranked number 4 in the nation and has been the top-ranked hospital in New York for 20 years, according to U.S. News and World Report. As a pillar of the community and the leader of a healthcare system serving countless New Yorkers and people in this region, we are so proud to present Steve Corwin with the 2021 Changemaker Award. Congratulations, Steve.
Well, thank you, Marvin, for this great award from PACE. And we have great affection for the College of Healthcare Professions. We have over 285 PACE alumni that are employed by New York Presbyterian. And I think that's the largest amount of alumni that is employed by a healthcare system in New York. PACE is integral to New York. New York Presbyterian is integral to New York. And during this past year and a half, we've really understood the value of all healthcare professionals in terms of the vibrancy and the solidarity of our city, whether it's equitable healthcare or critical healthcare needs of all of our communities. So PACE is an integral part of what we need in New York City as we recover. The College of Healthcare Professions is really a terrific exemplar of that. I want to also congratulate Mike DiSimone and Dean Feldman for their awards as well. I accept this award on behalf of the entire New York Presbyterian family. So thank you so much for this great honor. Thank you.
Thank you, Steve. And now, Michael DiSimone, PACE University class of 1992 and MBA class of 1998. Who is president and CEO of PayFlex, dedicated to make it easy to plan, save, and pay for personal well-being. And as a loyal customer, thank you, Mike. Under Mike's guidance, PayFlex is working to deliver personalized healthcare solutions that support members on their path to medical and financial well-being. And Mike is determined to deliver exceptional service to help people achieve their health ambitions and optimize their healthcare dollars. And we know how important that is. For his visionary innovation serving PayFlex's members, so proud to present our alum, Mike DiSimone, with the 2021 PACE Changemaker Award. Congratulations, Mike.
Well, thank you, Marvin. Thank you, everyone. And I'm very proud to accept this award as well. And let me take this opportunity to also congratulate Dr. Corwin and Dean Feldman. It's an honor to be recognized with both of you. And special thanks to Pace University for all that you do to help educate and prepare the leaders in this industry. As part of sitting on your council, I have firsthand knowledge and experience of how much time and effort you are putting into helping the PACE students, their families, and the communities work through this pandemic and be as prepared as they can be for what lies ahead. So I'm very proud again to be recognized, and I thank you for all you do for this industry.
Thank you, Mike. And now, Dean Harriet Feldman has served since 1993, educating and mentoring generations of young healthcare professionals and some not so young. She has been dean and professor first at our Lienhardt School of Nursing and starting in 2013 at our newly created College of Health Professions. Under her leadership, CH 10 new programs in health professions and enrollment has nearly doubled. She has really transformed PACE in a very, very profound way. Harriet is a fellow of the American Academy of Nursing, a member of Sigma Theta Tau, International Nursing Honor Society, and the American Association of Colleges of Nursing, and a fellow of the New York Academy of Medicine. Next month, Harriet as Dean of the College of Health Professions, but I'm very pleased to report that she's going to stay on, thank you, Harriet, as a senior advisor to the university. And I'm going to let you in on a secret. Tomorrow is a very special day because Harriet Feldman's birthday is Cinco de Mayo. So I don't know if this was scheduled. Happy early birthday, Harriet.
Thank you.
I won't ask everybody to sing happy birthday because they probably don't want to hear me sing, but it's a virtual happy birthday or something like that. Dean Feldman, for your dedicated leadership in healthcare and for your many, many years of leadership at Pace University, we are so proud to present you with the 2021 PACE Changemaker Award. Congratulations, Harriet.
Thank you. Here's my lovely award. Thank you, Marvin, for your kind remarks and this wonderful acknowledgement of what I love, being Dean of the College of Health Professions and the Lienhardt School of Nursing. I truly appreciate all of the support you have given the college and me personally since you arrived at PACE. The first course I taught to graduate students in nursing back in the 70s was called Change Theory. Little did I know at the time that I would embrace the idea of change and become a change maker myself. A great deal of positive momentum has led to many changes in the college since its inception in 2010. This could not be possible without so many terrific, hardworking individuals. I've been blessed with an amazing support team, past and present, who helped me to be an effective leader. I would especially like to thank Jerry Colombrero, who's been my sidekick all along and has become a very special friend in the process. Jerry sometimes gave me difficult feedback that I might not have always liked, but needed to hear. And for that, I am most appreciative. On many occasions, I have received praise that CHP and the nursing program are models for other schools and colleges at PACE. This would not be possible without my CHP colleagues, past and present, and many others, and your strong commitment to our success. I'm also fortunate to have had so much support from our past presidents, provosts, and members of the Board of Trustees and other leaders to navigate difficult waters and provide opportunities for me to grow and to lead. During the past few years, my work has grown exponentially in terms of outreach to our countless clinical partners. There are so many common concerns that we share as we prepare the new workforce each year. Working together has made us individually and collectively more effective in our commitment to serve the public. I greatly value their partnership. Last, but actually first on my list in terms of importance, is my family and close friends. Their love and support have been paramount to my success. Over these many years, they have been most patient with my mishaps and absences, my joys and grieving. I've always been able to count on them 100% when I most need their support. I love you all very much. Thank you again for the award. PACE and the award will forever hold a very special place in my heart. Congratulations as well to my fellow nominees, Steve Corwin and Mike DiSimone. Thank you.
Thank you, Harriet, and it's really a delight to honor you this way. So now we're going to have a discussion, and I'm very excited because I know that we are all very interested in finding out more about the changing healthcare industry and what is going to be happening. And let's start with Steve, because I remember, Steve, I think I wrote you early in the pandemic, you were on some radio program and you were very sage about what was going to happen. And if I recall correctly, you were very prediction. So I'm setting the bar high for you tonight. Few of us could have expected the challenges across our organizations. We're at the cusp, perhaps, in this country and in this region. Can you talk a little bit about what's your greatest challenge and what is your response to the challenges that we're facing right now? Those are big questions.
Well, I think that it was pretty clear that New York had the worst of the pandemic early on. It was horrific for our city. It was devastating in terms of the lives lost. We knew from modeling of what we saw, not only in Wuhan, but in Italy, that with widespread community spread, which it became clear we had by March 1st, that we were going to be in for a pretty horrific time. I would say that the lack of testing was a problem. We were not as prepared as a country. We didn't get testing ramped up as quickly as we needed to. Our supply chain was frayed. We had never anticipated from a hospital disaster planning standpoint that we were going to have an epidemic, a pandemic of this magnitude. And I'll just give you one example that I've told many. We anticipated that we would use 4 to 5 times the number of surgical masks that we ordinarily use on a given day. So we use 4,000 masks a day. We had anticipated during the course of this type of illness that we would use 16,000 masks a day. We ended up using 100,000 masks a day with a frayed supply chain from China and from Italy. So we had to radically rethink our supply chain. And we have to think of ourselves now as just-in-case institutions as opposed to just-in-time institutions. So it was horrific. I'm glad that we were able to get through it, but I think that we learned a lot of very sobering lessons from it.
What are the responses, what responses do you think are going to be long-lasting for us? What do you think the transformation is that we should expect? And obviously a lot, but
well, I think that we've seen the acceleration of digital transformation, and I know that the PACE is now inaugurating a medical informatics degree, which I think is Dean Feldman. I think that's a terrific idea. We now know the absolutely critical nature of medical informatics in healthcare, and we saw with telehealth the need to basically expand that digital transformation. We would have been lost as a city without telehealth. We converted all of our regular visits to telehealth. So digital transformation is here to stay and the acceleration of that. And I applaud PACE for recognizing that. Secondly, as I just said, I think that you've got to think about being a just-in-case hospital as opposed to a just-in-time hospital. And that means in crises like this, you have to have the ability to have critical care beds manufactured, if you will. So you have to have a higher resting complement of critical care beds, and you have to be able to staff those critical care beds. And I have to tell you that one of the things we learned, which is going to be a take-home lesson, is you absolutely need allied healthcare professionals to be able to achieve this level of taking care of patients. So respiratory therapists, physical therapists, and we talked about medical informatics. So I can't even begin to tell you how critical the College of Healthcare Professions is to the response to these pandemics. I'll give you one anecdote. You may have heard about patients being ventilated prone, turning them over to ventilate them while they're on their stomachs as opposed to on their backs, because that helped the ability to oxygenate patients. It takes 6 people to turn one patient over. You need physical therapists in the room to turn the patient properly, along with nurses and other allied professionals. So it's a real team effort. And I think that we learned a great deal about teamwork and allied professionals helping the doctors and nurses. And I think it's critically important to remember that.
Thank you so much, Steve. Mike, what about you? What changes in the way people are consuming healthcare have you seen, and what is your thought in terms of the future?
Sure. So for us at PayFlex, we're not as much on the clinical end. We're much more on the insurance and payment administration end. So we need to make sure that we're making it very simple and easy for people to still have access to their healthcare and be able to take care of their healthcare needs. And so for us, having this new environment where we've got folks that are working remotely, we have some individuals maybe either avoiding or delaying seeing healthcare workers because they're worried about exposure, and now getting used to a lot more teledoc kind of healthcare. We've got to be able to respond and make sure it's very easy and we're very nimble for people to understand what their benefits are and to be able to feel comfortable they can afford the out-of-pocket through the programs available to them from their employer, but administered by us.
Are you seeing what Steve was talking about in terms of the shift to technology? Is that something that you think is going to be long-term? And if so, is that going to change the way that costs are allocated? Or, I mean, what is this going to mean if it does continue?
I do think it will continue. I think Dr. Corwin's correct. I do think what we'll start to see is that there'll be a much heavier reliance on digital input and taking advantage of information we have on your healthcare behaviors, on healthcare trends, and using that to interpret what maybe the next best action could be for your well-being journey. And so it's very difficult to predict with certainty what that could be, but we can use artificial intelligence, digital technology to be able to sort of give you a range of options and then help prompt you to be proactive so that you can maybe intervene and intercept some, very, very, acute healthcare needs and of course, acute costs.
Harriet, how has healthcare education changed or changing? And how do we ensure that the students that are coming into this field can deal with the forces that Steve and Mike have described?
One of the issues we faced with the pandemic was that our clinical sites were closed to us. And so we had to figure out how to teach students who are clinically based programs. So we pivoted to virtual simulations for one. And in doing that, we found that this is a really successful kind of teaching tool. And so going forward, I think that we're going to see a lot more of it as substitution for some clinical time, in addition to being an adjunct to clinical time. The other thing that we found is some new ways to partner with clinical sites. We help them with COVID screening and testing activities. Now we are working on having students who are giving the vaccine. And so while our goal was always to maintain a quality program, we really needed to be flexible and figure out alternative ways to do that. Our new reality is, I think, telehealth for sure. We use it in our university healthcare for patient care, but as well, our students are being trained on it so that they can use it as practitioners when they graduate. We're doing some simulations with telehealth as well. And then the other thing is, I think the whole shift to population health is certainly becoming more and more relevant in terms of prevention, treatment in groups of individuals with like situations. I think we're going to be focusing more on that as we go forward.
I'm going to go off script, which is always dangerous, but I'm going to ask each of you to think about a group of people and what they're telling us and what we should be thinking about. And so, Mike, let me start with you and ask you, what are consumers telling you about how they're feeling about healthcare right now? What are the messages that we should be hearing?
Right now, I think the consensus is it's overwhelming. Understanding how to navigate this environment, lots of regulation is changing, lots of rules are changing, eligibility requirements become quite complicated. You've got a lot of consumer health driven plans and high deductible plans that are difficult to navigate through and to select. And I think people ultimately want to make sure they're making the best decision for them and their families on what they can make available to them to help themselves be the healthiest they can be. And, we're hearing that more and more from people. And I think what we're starting to see more of, at least, we start to see more of is, I think mental health is becoming less taboo. I think especially now, post-COVID, people recognize the amount of emotional stress it's created on lots of people, depending upon whether you were a frontline worker or you had people affected in your family. I think that people are more willing to share that they got, emotional health needs that need to be addressed, and understanding where to go and how to facilitate getting the help you need. I think is becoming an increasing concern.
Steve, we've heard a lot about burnout on the part of health professionals, and I'm just wondering what you're hearing. And I'd be curious if it differs across different categories of your employees.
It's been a very difficult time for our employees, and that goes across the entire spectrum of employees, from environmental service workers to food service workers to doctors to nurses. I think the profundity of this was just incredible, and the fact that it is still continuing now. I'm a little bit surprised that everyone thinks that New York can completely reopen in a couple of weeks. We're still seeing a lot of COVID from the January surge. So I think we're seeing during the first wave, we saw incredible resilience, fortitude, and relief when it calmed down over the summertime. But people were really burnt out. They were working 16-hour days. They weren't seeing their families. We domiciled 3,000 people who didn't want to be with their families. We had an 80-bus service so that people wouldn't have to take mass transit. We provided our employees 4 meals a day. It was tough. A lot of people lost relatives. A lot of people lost lives. And then you had the completely unmeasurable tragedy of healthcare workers FaceTiming relatives who could not visit their dying relative in an ICU. I remember when my father died a number of years ago, it was a great comfort to me that I was by his bedside in the hospital when the drips and pressors and things were turned off. Imagine being the family member and you're on FaceTime. Imagine being the healthcare worker facing that. We had a very prominent suicide of one of our emergency room directors who became quite depressed, went home, was hospitalized, and then committed suicide. So it's been a heavy toll. I think now what we're seeing is people are just emotionally spent. This has been over a year. It's been very difficult on their families, on themselves. But I will say the sigh of relief and the joy that went through our employee population when the vaccines came out was just indescribable. That sense of there's a light at the end of the tunnel. We can see the light at the end of the tunnel. So very difficult. We have a lot of mental health services that we offer people. But as Mike said, despite the fact that there is still, there's less of a taboo, people are very fearful of saying, I need help. I need help to cope with all of this. So it's been an uphill struggle for us to get people to say, it's okay if you need help. Please, raise your hand.
Thank you. Harriet, how about the students? What are you're hearing? Are people burned out, or are they second in the healthcare field? What do you hear?
I think they're exhausted, for one thing. The stress of trying to get their education done and get it done on time, or have it be even beyond that, has been very difficult. In some of our classes, particularly graduate, those folks are out giving, in nursing, they're giving care all day, and then they come to a class in the evening. And some of them, interestingly enough, were happy to come because it was a breather. It was a time away from the very difficult work environment where they could be with colleagues and spend a little time besides the class content to do a little kind of decompression after a difficult day. But I see students, I hear from them all the time. They're very stressed out. And if I'm not giving anything away, Marvin, I know that one of the areas that I'll be working on is mental health, and looking across the university and particularly the student population to see how we can help them. It's just been really hard on everybody. Students don't always have the best conditions to sit and learn at home. We're sitting in closets or in a room with 5 other people, everybody trying to focus, and so there are a lot of challenges that our students face, for sure.
So what's interesting is that, and we did not plan this, that all of you ended up lighting on a very similar issue: exhaustion and mental health and well-being. And I'm wondering if, although we're very cordial and we all love each other, but certainly the healthcare industry, sometimes people don't always work as well together, and there's obviously financial incentives and so forth. What are the changes that you see that might come about as a result of this this pandemic and all the things that we've talked about? There are going to be policies that are going to change? Do you think there'll be more informal collaborations, or how do you see this evolving? Let's start with you, Mike.
I think we're already starting to see some policy changes. Some of them may be temporary, but we've seen additional allowances being made for certain procedures being covered by programs. We're seeing concessions made for what might be carryover dollar amounts for certain benefit programs. With all the unemployment, for example, we've seen concessions made for how long you might qualify for being on COBRA benefits. So I think we are starting to see a little bit of concessions being made, policies being reconsidered that will effectively extend either deadlines or extend allowances available to people to encourage them to get the health care that they need. But I do think there's a lot that is still unknown and uncertain, and it's changing very rapidly.
Steve, what about you?
Well, I think that the pandemic during the spring and then all the events that were happening in the country during the spring, you had this nexus of a healthcare crisis, an economic crisis, and a social crisis. And you had the combination of those things. I think that from my perspective, I think that the disparate outcomes in Black and brown populations, the issues around social determinants of health, the issues around social justice. I can tell you that my employees universally have talked about health justice issues to sort of redefine the landscape in terms of equal care, equal outcomes, whether it's Black maternal mortality and morbidity during pregnancy, whether it's poor surgical outcomes in Black children, whether, I can go down the list of things. And it's not just access to a primary care physician, it's the full range of health outcomes. And I think that will change. I think that there's a lot of talk in the country around, are we racist? Are we not racist? But the one thing that I think everyone can agree upon is the hard facts around outcomes in minority populations is something that has to change for us to be a better society. And I think that we in healthcare have to make that happen. And I feel that's been a positive outcome out of this, is to the emphasis on a single standard of excellent care, regardless of what your means are. And we've just got to get to that point of equality of outcomes and what we would call health justice.
Steve, how do you see that playing itself out? Is that something that the healthcare sector is going to tackle? Is it going to be government? Or how do you see that moving forward?
I think I think that you're starting to see governmental policy reflective of the fact that everyone's got to get insured, that we've got to be able to prevent people from going bankrupt for getting health insurance. I think you're seeing the healthcare sector now, hospitals, academic centers recognize that their swim lane has to be wider, that you have to take into account more of the social determinants, that we've got to be much more vigilant about looking at outcomes. I think that it's going to play itself out in a private-public partnership that will advance care. It's like the old Churchill line, right? Americans always get it right after trying everything else and failing. So I think that ultimately we will come to a more equitable way and a better healthcare system. I think this should have spurred us to do that.
Thank you for that, Harriet. What would be your answer to?
I think that education has to work much more closely with our clinical partners for a couple of reasons. One is so that we can understand how to best prepare our students for practice in those environments, but also so that students get better experiences. Greater integration into the healthcare system for student experience is paramount. For example, dedicated education units where groups of students will be on a unit for a semester, 2 semesters, a given period of time, to be able to be integrated into the care that's given on a continuous basis. And then the other thing I think that we need to do is a better job of, in terms of diversity and inclusion, by preparing more faculty of color to teach our students. We have a very diverse student population, but our faculty is not mirroring that population very well. And so students need role models and so forth. So I think that we're going to need to invest in that part of the workforce.
Thank you, Harriet. Mike, I'm going to go back to you just because Steve and Harriet brought up some themes, and I'm just wondering, and I don't want to put you on the spot, but I'm wondering if in your segment there are discussions about how the system of insurance or payments may affect people unequally, and if do you see any reforms coming, or what's your sense?
There's a very active role that Aetna and CVS Health play, and of course we're owned by Aetna and CVS Health, with the government affairs group that works closely with the policymakers. We get to have the opportunity to provide input and to provide our point of view on some of the changing policies, and we are trying to find that right balance of how do you make it as equitable as possible, make it as available to everyone as possible, and as Dr. Corwin said, it shouldn't be based on your means, right? And so I'm not at liberty to disclose specifics, but we do have a group dedicated to working closely with policymakers on how to find that balance.
Yeah. All right, this is going to be sort of the combination lightning round. If President Biden walked into this Zoom alongside the leaders of the various houses of Congress and said, we'll do something for you. Just give me one thing to do. What would the one thing be? Let's start with you, Steve.
You're really going off script now, Marvin.
Yeah, I'm just having fun.
I think it's got to start with make sure that every American has insurance, because I believe that healthcare is a right and not a privilege. And I think that whether it's the modification of the ACA, the expansion of Medicaid, the ability to have child tax credits, whatever those things are, I think that's critically important. I personally believe that private health insurance with the ACA, with Medicaid and Medicare can be made to work and work effectively. And I think it is eminently feasible for that to happen. And I would urge Congress to get the act together. I don't see how you wouldn't expand Medicaid in a state where you have to be at 18% of the federal poverty line to qualify, which means that you're making $7,600 a year in some states. Now, I know states that are not as wealthy as New York, but that's still an awfully high bar for people. And I just think that it is essential to insure every American. Then you can start to deal with the issues about equitability of care, et cetera. If you don't have insurance, you're out of the game day one.
Mm-hmm. Harriet?
I would say ditto, but I would also want to have a greater investment in health professions education. I think that people need loan forgiveness kinds of programs, other incentives, so that they come into the various health professions and don't go out with so much debt that they're bogged down for the next 20 years of their lives.
Mike?
I can't disagree with anything that Dr. Corwin or Dean Feldman just offered. I would ask for the same. I do think, though, if there was a way to apply the same level and sense of urgency and prioritization that we put into the vaccine on curing other terminal diseases, that would be an ask, right? I mean, how quickly we figured out a way to solve this with a vaccine. Why can't we do that with some of these other horrific terminal diseases that are not just taking family away, but taking a lot of dollars out of the healthcare system for treatments, right? So whether it be cancer or other things. So I would ask, is there a way to really pull back the covers and say, where are we not doing this fast enough? And whatever tricks we pulled out of the hat to figure this out for the vaccine, apply that to some of these other really horrific terminal diseases.
Mm-hmm. All right, here's the second part of the lightning round. What can the people on this Zoom call do that would be helpful, either to you or to your sector, to help bring about the kinds of policy outcomes that we've talked about? What are people like us who don't represent Congress or aren't in Congress or anything like that? What can ordinary people do to try to advance the ball right now in healthcare? Harriet, I'm going to start with you.
Good, because I really think that people need to support legislation to make these changes. They just don't happen in a vacuum. People have to really get together and develop a language that will help to move some very important legislation forward. For example, in New York State, there's a need to lift the various barriers to nurse practitioner practice so that they can easily practice as soon as they complete their studies, and they don't have to wait a period of time with a partnership to ensure that they're doing the right thing. I also think, for example, we have a bill that we're trying to move through New York, through Congress, to pay a tax credit rather to preceptors, so that we can get more assistance for preparing our various students who need precepted experiences. So I think And there's just so many other things that keep coming across my desk asking for support. And I think we really have to do it at the policy level.
Harriet, if you had a child or a niece or a nephew who was thinking about healthcare, would you still encourage them to enter that field right now?
Yes, I would. I think that the opportunities are boundless. I think that the rewards are both internal and external kinds of rewards are tremendous. I've been a nurse for 50 plus years, and I have never had a day of regret. I think it's a wonderful field, and I think many of the other health professions as well are especially in need and could certainly benefit from people who want to go into those other professions.
Mike, what would you tell the folks on the call?
Well, you certainly have to be active with your local and state governments for sure to have some sort of input and influence. But I think the other thing that we can all do individually, even if you're not associated with the healthcare industry formally through your employer, get active in your community. We have programs at Aetna where we go to people's homes. We make sure they have the right food in the refrigerator. They got to pick up their medication. Can they eat? Getting a ride to the senior center? Do they have any interaction with people so they keep themselves stimulated? Right. And there's a whole host of other things that we do in the local communities. And if you could just take an active role in your community from that perspective, I think that goes a long, long way, paired with, be a voice with your local and state government agencies to make sure that your opinions are heard and that you're advancing the legislation that you think will have the biggest impact.
Thank you. Steve?
Well, I sort of look at it in the following way. I think that New York Presbyterian is a New York institution, proud to be a New York institution. PACE is a New York institution, proud to be a New York institution. The people on this webinar are New Yorkers who love this city and want to see this city thrive. And you can't have a thriving city without a thriving healthcare sector and a thriving healthcare infrastructure. And we showed that during the pandemic. Very few cities could have withstood what we withstood collectively. And whether it's supporting the education of healthcare professionals, whether it's supporting policies that limit the debt of people going into healthcare, whether it's supporting the institutions themselves, supporting your educational mission, healthcare is vital to the well-being of New York City and New York State. And I think that whether it's business leaders, community leaders, people who are interested in climate change, people who are interested in all sorts of things in the city, this city needs its healthcare infrastructure, and we should support all aspects of it. That would be my message.
And Steve, I know that you're very interested in the workforce of the future. What would you say to people who are considering a career in healthcare?
I've had a very rewarding career in healthcare as a physician. There is nothing that you can that replaces the joy of being able to participate in the care of a patient and make that person better, make that person more comfortable. I can't think of a more noble profession, a set of professions. I would encourage people. I would encourage my own family to go into it, but they decided not to. But I think that I just think that it's a very rewarding set of careers that can be fashioned out of healthcare. And Dean Feldman said her experience as a nurse, she didn't regret it for one day. I've never regretted becoming a doctor. The talent of the young people that we see coming through our educational systems, whether it's medical schools, whether it's the College of Health Professionals, I'm not sure I would get into medical school now in terms of the talent of these young individuals. And I think that it bodes well for our future. And I think it's great. And I'm not trying to feather Pace's nest. You provide an indispensable resource to this city in terms of the educational opportunities you're offering for New Yorkers to get into healthcare.
Well, this has been a wonderful and inspiring kickoff to our new award, the Changemakers in Health. And I must say that if I were so lucky as to have a teacher like Harriet Feldman, an advisor like Mike DiSimone, and a physician like Steve Corwin, I would be a very, very happy person indeed. And you all are just wonderful, inspirational role models to all of us. And we thank you for everything you're doing to try to make this period in our nation's history much better for all of us. So we're very grateful to you. Thank you very much. Thanks to everyone for joining.
Thank you.
Thank you.
We'll see you soon. Bye-bye.
Thank you very much.
Bye-bye. Congratulations.
Thank you.